Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. And looking forward to spend some time with Teody Aves, and he's with a firm, a medical practice called Pain Relief Associates. And delighted to have you on the program today, Teody. Tell us a little bit about yourself and your medical practice.
Well, thank you, Kevin. My medical practice is one for pain management with all types of pain, neck, back, but I have a subspecialty of migraines, which I tend to treat migraines in a way that most doctors don't. And it's basically to allow the patient to function at a level where they can do what they need to do without a bunch of medications and to have results in a shorter time period.
Mm-hmm. Very good, very good. What is the difference between you and some of your other doctors who are trying to treat the same issue? And this is like one of the biggest issues facing people these days is migraines.
Oh, absolutely.
And there's so much awareness about it these days. And more hope probably than ever to actually get relief and understanding what's happening and why. But what differentiates you from others out there?
Well, let me start, Kevin, by telling you what my definition is of a headache versus a migraine. A headache is a pain in your head that you can take over-the-counter medication for and still allows you to function during the day. A migraine is a pain in your head that no matter what you take, all you want to do is be in a dark room, turn the lights off, close the door, and put your head under a pillow and hope the pain goes away. You're totally non-functional. So that's the difference, being functional versus non-functional. And current therapy right now has to deal with a lot of medications that affect blood flow to the brain. And I call it smorgasbord of medications because they put you on a drug and they'll see if it works for 3 months. And if it doesn't work, you can move on to the next drug and so on. And if it does work, it might work for a year or 2 years before it wears off. And working, by definition, is relief, possibly by decreasing the frequency of migraines by maybe 30%.
And maybe the pain while you're under the migraine.
Oh, absolutely. And that's it, Kevin. I'm not only treat migraines, but I also have migraines. And so I know what it's like. And when you have a true migraine, a minute seems like an hour seem like days, and days seem like you want to put a bullet in your head.
Right.
So having the current therapy of treating your migraine with a carousel medications that takes months to work and maybe work for a short period of time wasn't enough for me. Mm-hmm. So what I tend to do is to focus on what I call the trigger for the migraine. And like I said, a lot of the medications treat what's in the brain, blood flow and whatnot, and you need to make sure there's nothing up there that shouldn't be there, which is a mass or some bleed in your head. But I can treat migraines by focusing on things that aren't in your head, if you can believe that. A lot of patients have neck problems. A lot of patients have TMJ problems. They bite down all night long. A lot of patients have sinus problems. A lot of patients have shoulder problems. All of this is the etiology or the focus of the treatment of pain that leads to a headache, that progresses to a migraine, that progresses to a point where they're non-functional and they have a downward spiral where they can't work, their relationships suffer, their time with their family suffers, and before you know it, they're on disability and staying home all day long.
Mm-hmm. Right. And so how long have you been doing this?
I've been doing this now for 3 years. I've been in practice for 23 years. I'm a board-certified physician in anesthesia, and with anesthesia, we treat all types of pain, inpatient, outpatient, and it was that background that's allowed me to appreciate the pitfalls, the downfalls, and the peaks of therapy. And it's with this that I've actually been able to develop my algorithm for identifying pain and not have to take 3 months to determine whether or not it's going to work. I can most often identify the trigger in my office on that afternoon and start working in that direction to get the patient more functional. And that's the key for this, is getting the patient out of the house, being able to work and do what they want to do.
Mm-hmm. Yeah, absolutely. And, well, you know, so you kind of laid out a rather, I would say, sad scenario for the typical patient going to a lot of these practices. 30% is what they're shooting for, months before they see if they get that. What kind of time frames do you typically shoot for with your patients?
If they can follow the therapy, and part of the limitation of therapy is the cost, which is might be limited by insurance, but I can identify more often than not the area that we need to focus on in the first or second visit. I need to get an MRI and such, but overall, the therapy begins on the first visit, and I can have improvement within the first week. And again, I want to stress that regardless of whatever you have, migraines or whatever kind of pain you have, this is a chronic disease, just like high blood pressure, diabetes, or heart disease. It's something you have to treat on a daily basis, because if you don't, you're going to get worse. But if you maintain a therapy that works, you're going to see more good days than bad. You're going to see more time outside the house instead of in the bedroom, and you're going to be able to do what you want to do. Again, being functional is what I'm shooting for.
Mm-hmm. So, are you taking anything? Is there any traditional type medicine that you bring to this, or is it all? I mean, kind of talk a little bit about your methodologies. Well, elaborate a little.
Let me tell you a story of my account that started off this way. 20 years ago, I developed a bad headache, and it was because I had the flu and I was coughing a lot. I ended up going to the ER. They worked up a meningitis workup. They stuck a needle in my back to do a lumbar puncture, and then I had two headaches, the one I started with and the one that I got from the lumbar puncture. Next thing I know, I'm in a neurologist's office getting placed on all this medication that made me goofy, like walking through a fog where I couldn't function and barely get me through the day. What the problem was that the coughing caused a lot of stress in my neck and my neck muscles, which then progressed to a headache from the back of my head moving forward, and as that headache progressed, it ended up behind my eye. Well, I started thinking, what is going on here? Why am I having this problem when I didn't have it before? And I focused on the areas that I was trying to treat, which actually did work. And in my practice, the whole point is identifying the area that you need to treat and not trying to use medications to put a Band-Aid on the problem. Because a lot of the medications that you end up taking make you feel like you're walking in a fog, your fingers get very numb, your feet get very numb, and it decreases your performance. Whether you're an athlete, a business person, a school teacher, or even a college student, it's difficult to go through the day with all those medications on board.
Yeah, absolutely. And you wouldn't even have to be in a professional career or in a student, where you have to function. Just functioning in general, your vehicles, driving from point A to point B, all of that's very crippling. I guess it's great you can be on these heavy drugs if you don't have to do anything. But if you're trying to function, good luck with that.
No, absolutely. And that's my whole point. These patients have had migraines for 10, 20, 30 years, and it's a very debilitating disease. But I do just want to offer the listeners out there that there are options. You don't have to be depressed. You don't have to walk around in a daze. You don't have to miss out on what you want to do in life. There are options that either are through injections, surgical options that allow you to get to the point where you can be migraine-free, headache-free for a period of time and have a better life.
Yeah, absolutely. Well, I appreciate it. Let's give that website. Give your website real quickly.
It's very simple, livewithrelief.com.
livewithrelief.com, and you've got locations throughout the greater Houston area. Encourage you to check it out. And again, it's Dr. Teody Aves. Thanks for being with us.
I appreciate it, Kevin. Thank you.
You bet. When we come back, much more for you. Do want to remind you, best content here shows up over there at usdatareview.com. While there, like it on Facebook, follow it on Twitter, and this is The Price of Business.